Let us talk about carbonic anhydrase inhibitors. So bicarbonates penetrate the luminal membrane very slowly, and its absorption in the proximal tubule is heavily dependent on the presence of an enzyme, carbonic anhydrase, which is a zinc-containing enzyme whose function is to speed up the attainment of equilibrium of the reaction, which has the formula CO2 plus H2O equals to H2CO3, or what we call the carbonic acid. Carbonic acid forms in small amounts when carbon dioxide dissolves in water, yet decomposes rapidly under ambient conditions of temperature and pressure. So this enzyme is found within the proximal tubule cells and in association with their luminal brush border. The role of carbonic anhydrase in diuresis is that it is capable of accelerating this reaction in either direction. The activating step in the process of bicarbonate absorption is the secretion of the H+, or hydron, which is the general name for a cationic form of atomic hydrogen, into the tubule lumen, which is largely responsible for the favorable electrical gradient down which sodium diffuses into the cell. The hydron is derived from the dissociation of carbonic acid, whose supply is facilitated by the presence of carbonic anhydrase. The carbonic anhydrase inhibitors interfere with the absorption of bicarbonate from the proximal tubule by reducing the supply of hydron to the membrane pumped and by reducing the rate of absorption of carbonic acid from the lumen. Therefore, the filtered bicarbonate is thus trapped in the urine together with an electrically equal amount of sodium and an osmotically equivalent amount of water. These drugs cause an increased excretion of bicarbonate with accompanying sodium, potassium, and water excretion, resulting in an increased flow of alkaline urine with mild metabolic acidosis. Therefore, they are poor diuretics because there is compensatory reabsorption of sodium in the segments further down the nephron. So these drugs are used in glaucoma and in some types of epilepsy. Their action results in the depletion of extracellular bicarbonate, and their effect is self-limiting as the blood bicarbonate level falls. Some side effects are drowsiness, numbness, and tingling of the face and extremities due to the metabolic acidosis and disturbance of vision. One example is acetazolamide, used as a carbonic anhydrase inhibitor, which is a derivative of a sulfonamide but does not possess any antibacterial action, and also a non-competitive, irreversible inhibitor of carbonic anhydrase. Now let's go to loop diuretics. Loop diuretics are high-ceiling diuretics, which are the most effective diuretics, which has fairly high proportion of sodium, is also reabsorbed in the loop of Henle, which is about 22%. They are inhibitors of sodium, potassium, and chlorine symport, which induces inhibition of chloride pumping throughout the whole length of the thick ascending limb of Henle, thus paralyzing the kidney's ability to concentrate and to dilute the urine, where their effect is from the luminal surface of the loop cells. So these drugs are extensively bound to plasma proteins, and relatively little is filtered in the glomerulus, which are actively secreted by the organic anion transporters at the site of action. So substances like probenecid, which block this mechanism, can reduce their efficacy. So examples of loop diuretics are the furosemide, bumetanide, and ethacrenic acid. Whereas furosemide and bumetanide are sulfonamide derivatives which produces rapid diuresis and hence is useful in emergency cases because it is easier to control the degree of diuresis with this drug by varying the dose rate. While ethacrenic acid is not a sulfonamide derivative, thus it may produce clinical dehydration and acute circulatory collapse as it produces severe diuresis after administration. After administration of loop diuretics, there is an increase in the excretion of the calcium and magnesium and the decreased excretion of uric acid. Thus, effects of calcium is made use in the treatment of hypercalcemia. The loop diuretics are readily absorbed from the gastrointestinal tract and can also be administered parenterally. So, for the administration of loop diuretics, it can be orally or intravenously at 1 to 5 mg per kilogram in dogs, which can be doubled with successive doses until an effect is obtained. The duration of the action is about 4 to 6 hours. Meanwhile, in horses, the drug is given at the rate of 0.5 mg per kilogram to reduce incidence of epitaxis. A difference in administration is also given in cattle. It is given orally at 0.5 to 1 mg per kilogram to 12 to 24 hourly. So loop diuretics are useful in patients with salt and water overload due to acute pulmonary edema, chronic heart failure, and hepatic cirrhosis complicated by ascites, also nephrotic syndrome and others. So other clinical diseases like hypertension, especially if accompanied by renal impairment. Also for acute treatment of hypercalcemia. Untoward effects include potassium loss, metabolic alkalosis, depletion of calcium and magnesium, hypovolemia, and hypotension. Local irritation of gastrointestinal tract and competition with other drugs like digitalis are noticed. As with other potent diuretics, hyponatremia can occur, but deafness is an adverse effect peculiar to loop diuretics. Hence, concurrent dosing with aminoglycosides is contraindicated when administering loop diuretics.